So thank you so much for taking time to share with us today. I would just like to first start with you sharing with us a little bit about your background. Who is Dr. Paul Juarez?
Okay. Well, I was born and spent my early childhood in Yakima, Washington. My grandparents were migrant farm workers, and they settled in the Yakima Valley, and my parents met and got married, and I grew up in Washington State, did a lot of traveling, ended up doing my PhD in Boston at Brandeis University, met my wife, have two daughters, now both married. One is having a baby, so we're excited about that.
Congratulations.
Thank you. And currently I'm the Vice Chair for Research in the Department of Family and Community Medicine at Meharry Medical College, and I'm the Program Director for the National Center.
Okay. So tell me a little more about the National Center for Medical Education Development and Research. I know that it focuses on 3 vulnerable populations. Tell us more about your work there.
So our center was one of 6 that was funded by HRSA, the Health Resources Services Administration, as national centers to look at transforming medical education. And our focus was to address the needs of vulnerable populations and to identify how medical schools are teaching their students to work with them. And so the 3 populations that we are charged with looking at are the LGBTQ, homeless persons, and migrant farm workers. So our work has, in the first year, we had 2 topics that we focused on. We looked at how medical schools are teaching students to deal with their implicit biases or stereotypes towards vulnerable populations. And the second topic that we focus on was how are they teaching them to prescribe PrEP or pre-exposure prophylaxis. And so what we have found is that they're not doing a whole lot. Not many schools really address these issues, and they don't address the needs of vulnerable populations. They may address homelessness in general, but they don't deal with, many of them don't have anything in the curriculum per se that addresses things like homelessness or substance use or abuse among homeless populations or LGBTQ populations. So again, we started out, the first thing we did is a systematic review of the literature on both of these topics to see what was out there, what we could find in the medical literature or medical education literature about what schools are doing. And there's not a whole lot there, so we're following that up with some focus studies. We were interviewing medical schools, staff at medical schools, to find out if there's anything in their curriculum. And for our second year, the topics that we're focusing on are the effects of adverse childhood experiences and exposure to interpersonal violence across the life course. And again, these are topics within these 3 vulnerable populations we're particularly interested in because the literature shows that all 3 populations that are high risk for these topics.
So can you tell me a little bit about the communities of practice and how that specifically fits into the work of the National Center?
Yes, the communities of practice has been a real integral part of our work. And what we've tried to do through that is bring together the different target audiences that are dealing with these issues. So we have medical educators, we have clinical providers, physicians, nurses. We also have people that are working directly in the field, say with the LGBTQ populations like my house, and we also have people who are sort of the consumers, or the persons that are seeking care. So we try to bring them all together to begin to talk about these issues, to identify what would work. And so one of the things that we're really interested in is to get the opinions of people of why they don't go to their primary care doctor to ask for PrEP, for instance. That's one of the issues. That is it. Do they feel comfortable? Is it a welcoming setting? And what could we do from the educational perspective to teach these young doctors how to prescribe PrEP and how to work with the populations.
Thank you. So last question, and probably one of the most important ones. If the center is successful in its work with regard to transforming medical education, what does that mean?
So there are different things that we can do. We want to develop curriculum modules and disseminate that to the medical education schools. We want to get that out to them so that they can adapt it. There are different ways they can do that. It's not just straight lectures, but we use simulations that we hope to be able to create simulations so students can practice, and develop their skills and become more comfortable in working with these vulnerable populations.